Good morning, everybody. This is Dr. Sonia McGowan with Covenant Pediatric Wellness Center. Welcome to our monthly webinar. So today we're going to be talking about PANS and PANDAS. A couple of things, just a little housekeeping. Please feel free to drop questions in the Q&A box. Drop them anytime, and as I'm able to answer them, I definitely will. I will also give a little time at the end for some questions as well. You will have access to a replay of this webinar. So as long as you're registered, you can go back and watch that as many times as you want. So I'm really happy that you're here. Looks like we have several people joining us. So, all right. So just a little bit about the practices that I own. So under sort of the umbrella of Covenant Pediatric Wellness Center, we do a lot of things. So we have a traditional general pediatrician on staff. So experience in complex kids, but also experience, just in standard pediatrics. She is currently taking new patients, and her practice is really busy, but we are still taking new patients. One thing that is a little bit different about her is that, well, our whole practice really respects families who have deeply held beliefs around vaccines. So we will not dismiss you from this practice if you do not want to vaccinate your kids. So all families are welcome here. We also really concentrate on working with complex kids. So that might mean kids with autism, kids with PANS PANDAS, sensory processing issues, ADD, ADHD, but then also, just things that may not have a label. So sleep troubles, limited eating, constipation, belly aches, diarrhea, things like that. We do a lot of work around oral restrictions, so tongue, cheek, and lip ties. And then we also do traditional chiropractic for babies, kids, adults, pregnant women. We also do lactation consulting, craniosacral therapy. So we do a lot of things here specific to kids because we love kids and we want to make sure that they get really good care. All right, so we're going to talk about PANS and PANDAS today. So just a little preview. So we're going to talk about what those acronyms mean. We're going to talk about symptoms. We're going to talk about potential causes and triggers. We are going to cover the best lab test to do to figure this out, and then traditional and holistic approaches, and then what you can expect in terms of, will your kid get better from this? So let's talk about the acronyms first. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS is that, but is associated with strep. So in just a minute, I'm going to kind of break it down for you as to what causes each one. But right now, let's just cover the acronym. So we have PANS, we have PANDAS. Sometimes you'll hear it called basal ganglia encephalitis. Totally fair. And also you may see it called childhood post-infectious encephalitis. So all of it is correct. I just want you to know what the different acronyms are so that when you see it in real life, that you'll know what it means. So let's talk about how it all fits together. So consider PANS, that term, as the overall umbrella. Underneath PANS, we can have infectious triggers or metabolic triggers. Under the infectious triggers, we can have a trigger of strep. When the trigger is strep, we call it PANDAS. If the infectious trigger is something else, like a different bacteria, like a virus, like something tick-borne, then we refer to it as PANS. If it's a metabolic trigger, those can be things like chemicals, pesticides, mold, anesthesia. If any of those things, any metabolic trigger, is going to be considered PANS. Okay, so PANDAS is strep, PANS is anything else. All right, so let's talk about the symptoms. So what you have to understand is that PANS is a neuroinflammatory autoimmune encephalitis, brain swelling, that can have both infectious and metabolic triggers like we've covered. And so we have to consider a diagnostic workup or referral if you're a doctor and you don't do this. So you have to consider a workup for any child with a new onset of symptoms or in kids with multiple diagnoses. So if I have a child who comes to me and they have this long list of diagnoses, I'm before I even take a history, I'm going to be thinking, I wonder if we need to do a PANS PANDAS workup, because PANS and PANDAS is not very well understood by the medical community. And so, traditional medicine tends to look at people in parts, right? So we have a neurologist, or we have a cardiologist, or we have a dermatologist, or we have a gastroenterologist, right? And they each look at their own little part of the system without looking at the whole person necessarily. And so PANS and PANDAS can look psychiatric. It can look like GI symptoms. It can look like immunology symptoms. And so sometimes it's hard to get that big picture. So anytime I see a kid with multiple diagnoses, I'm already considering a PANS PANDAS workup. So the symptoms. It's generally accepted that in the literature that it needs to be an abrupt onset of symptoms. So that's fine when you're looking at the literature. But when you're looking at kids in real life, sometimes it's not necessarily an abrupt onset. Sometimes it is a fairly abrupt onset, but kids can compensate, and maybe they're not really showing how severe their symptoms are. And so parents haven't necessarily figured that out yet. So for the sake of looking at what the literature tells us, it's an abrupt onset of obsessive thoughts and or compulsive behaviors. So obsessions are thoughts, compulsions are behaviors. These are a lot of the things that we see clinically. So we see kids who engage in hoarding. Really, really common for kids to suddenly start hoarding things. What I see most often is a lot of like paper and cardboard put under the bed. That's just a really common theme that I see. If you want to read more about hoarding and pandas, I have a blog post that will come up sometime this month. So watch thewhymatters.net or watch your email and you'll get a notice about that. Also things like checking, symmetry, wanting, things to be just right, counting. We see a lot of apologizing or confessing. So, I've had kids who will say things like, I'm so sorry that I'm the worst kid in the family. Or we'll see religious compulsions or intrusive thoughts about religion. Very common to see fears of contamination or germs. So that might be around things like food. It might be around hand washing. It might be around like bed linens, things like that. We also commonly see rituals around like lights and bedtime. They have to turn their light on and off a certain number of times, or they have to touch their bedpost a certain way in a certain number of times. And sometimes it really kind of amplifies around bedtime. Hand washing, sometimes aggressive rituals or self-injurious rituals, and then also kind of compulsive eating behavior. So it's common for kids to self-limit their diet. Sometimes it is an issue of germs and contamination. Sometimes it's more of fear of choking or vomiting. And so here we have, again, the abrupt onset of restrictive eating. This is very common in about 20% of the cases. Very frequently, we'll see observable weight loss and or dehydration. And so, like I mentioned, sometimes it's a fear of contamination, that they think the food is dirty or maybe it's poisoned. Sometimes it's a sensitivity. So one of the symptoms we'll talk about eventually is sensory amplification is a hallmark of PANS PANDAS. So things that never bothered them in the sensory realm before suddenly bothers them. So now maybe they're sensitive to the taste or the texture. Maybe it's the smell, the color. So sometimes it's that. Sometimes, though, it's a fear that they might choke or they might throw up. This is just a really common theme that we see. It is only occasionally related to body image or weight concerns. Generally, these are kids not worried about that. It's typically deeper than that. We will also see an onset of anxiety. It could be social anxiety. It could be very frequently separation anxiety. So when it's time for mom or dad to go to work or go to the grocery store, if it's time to go to bed in their own bedroom, we'll see some pretty significant separation anxiety. We'll also see very labile emotions. So up and down, they turn on a dime. So they're happy and then they're sad and then they're angry and then they're, happy again. We'll see a lot of irritability, a lot of aggression or what looks like defiance. And then frequently we'll also see behavioral regression. So that could be, maybe that's baby talk. Maybe it's a loss of social skills, a loss of play skills, or kids who will revert in their play skills. So maybe, it's a 10-year-old who suddenly, now wants to watch a cartoon that they watched as a toddler, or they want to play with toys that they played with when they were much younger. And we also see an inability of kids to sleep alone. So they go from, being fine, they're independent, they're sleeping in their own bed, to now they need to sleep with a sibling or a parent. One of the other symptoms is academic regression. And so what this looks like in real life, most commonly, is a loss of handwriting skills. And I have an example to show you in a second. A loss of math skills as well. And then sometimes we'll see this onset of what looks like ADD or ADHD symptoms in a previously, not ADD, ADHD child. And then finally, we'll also very frequently see a loss of executive functioning skills. So that ability to plan and prioritize, just kind of organize their thoughts and their responsibilities. We'll see irrational fears. One of the things that I'm seeing clinically in multiple kids is a fear of wind. Right? Odd, definitely. But when you hear this, different kids who don't even know each other say the same thing, suddenly they're scared of wind, you tend to pay attention. So what seems like irrational to us is very real to them. So we see a variety of things. Suddenly they're scared of the cat that they've had forever, or, they're scared of wind, or suddenly they're afraid that, a tornado is going to come. And sometimes kids will just ruminate around, what if something bad happens? What's going to happen to me if something bad happens to mom? We also see vocal and or motor tics. So we might see, a sniff or a snort, a throat clearing, shoulder shrug. It can be both. We also see changes in the way kids walk as well. They kind of develop some clumsiness sometimes. Their gait changes. And so uncontrolled motor movements are a big part of PANS and PANDAS. And depending on where their tic is, sometimes that can give us some clues as to where the pathogen might be. So for example, if I've got a kid who has a throat clearing tic or a cough tic, I'm going to look in their throat for a potential pathogen. So I might do a rapid strep test. I might do a throat culture. If I've got a kid who has a sniff or a snort as a tic, I'm going to think sinuses. And so I may do a nasal swab culture to see, has, strep or a different bacteria colonized in the sinuses. Or maybe it's a fungal infection in the sinuses that has been undiagnosed. So it's interesting how when you work with enough kids, you start to see patterns like this. And so definitely the location of that tic can give us some clues. And then again, the sensory amplification that I mentioned. So sometimes kids will, say they can't stand the way their dad chews their meals, right? Or pain suddenly is much more acute for them. Or they, see things or hear things that maybe they wouldn't have paid attention to before. Another hallmark is a change of urine habits. So this can look like a lot of different things. It can be bedwetting in a child who was previously dry at night. It can be accidents during the day, urine or poo accidents. Maybe a child will just have an accident at school and they haven't done that in years. Sometimes it's a full-on accident. Sometimes it's just a dribble. kind of multiple times throughout the day in a child who was previously dry. It can also look like urinary urgency. It can be increased frequency of urination or increased volume. So you notice that, they're not necessarily having accidents, but their urine volume is much more than it had been in the past. Another symptom is sleep disturbances. So maybe kids have trouble going to sleep. They have trouble staying asleep. They wake up in the middle of the night. Maybe they start having bad dreams or, nightmares, night terrors, things like that. Maybe they start waking at the crack of dawn and just can't get back to sleep. And, that impacts the whole family. Sometimes we see other physical changes. So I mentioned a change in gait or the way they walk. Sometimes we'll also see kids whose pupils are huge and they don't respond very robustly to light. So one of the things I always look at in my physical exam is their pupillary response. Very common to see, pupils big as dinner plates, especially during a flare. We also will see changes in their deep tendon reflexes. So sometimes they're different from left to right. Sometimes they're different upper extremity to lower extremity. And, the pupil issues and the deep tendon reflex issues, those are examples of a nervous system that is very dysregulated and stuck in fight or flight. So that's just another clue, another piece of the puzzle to put all this together. And then finally, inherent in PANS PANDAS is what we call a relapsing remitting course. So kids will have what we call flares. So symptoms will increase, and then after a period of time, things go back to baseline. And so sometimes flares are short-lived, sometimes they're long, sometimes they're mild, sometimes they're severe. But managing flares is a big part of this diagnosis. And so we try to work really hard with families to be prepared for flares, because inevitably, your kid's always going to flare or always going to get sick when it's, midnight on Friday night and nobody's available to help, right? The drugstores are closed, there's no doctors. So we want to give families a box of strategies that they can use to manage these things at inconvenient times. So I mentioned the loss of handwriting skills. So this is an example of that. So this comes from the PANDAS network, this first one. So on the left, you see the child's handwriting when they're stable. And then on the right, you see how their handwriting changes when they're in a PANS PANDAS flare. This next example is used with permission from a family of ours. So this on the far right is this child's handwriting when he is stable. And then here in the green is what his writing is like during a flare. You can see his penmanship is still very, very good. But what happens is he is compelled to write every verb he can think of, and he just keeps writing words on top of words. So definite changes in both of these kids when they are experiencing a flare. So PANS PANDAS is a very commonly missed diagnosis. What the literature tells us is that about half or more of kids will be misdiagnosed for over a year. And, when you're talking about a young child, a year is a long time in the life of a child. Part of the problem is that the vast majority of new strep infections cause no symptoms, but were immunologically significant. So these are kids who, when I ask parents, has your child ever had strep? And they'll tell me no, very earnestly. They've never been diagnosed with strep. But when we do the labs, we find huge strep antibodies, because very commonly these are subclinical infections. So they have a strep infection, but they show no symptoms. So parents don't know that they need to pursue treatment. Often, PANS PANDAS is misdiagnosed as the child having a psychiatric illness. And in all fairness, depending, I have seen kids with PANS PANDAS who look like it's a legitimate psychiatric illness when it is not. But I say that just to help you understand that, when mainstream docs don't understand or they're not educated in PANS pandas, it can look like other things, truly. So it can look like a psychiatric illness. It can look like some sort of tic disorder. It can look like obsessive compulsive disorder. It can also look like behavioral problems. And sadly, what a lot of families are told is that this is just a parenting problem. If you just give them a spanking, or if you would just do X, Y, or Z, they wouldn't behave this way. Of course, we know that's nonsense, but there are families who are very frequently told that. All right, so let's talk about the causes. So both PANS and PANDAS are clinical diagnoses. So we look at a combination of history, physical exam, and labs. About 81% of the time, the trigger is strep. So what we know is patients who have compulsive disorder, who have some sort of tic disorder or Tourette syndrome, are far more likely than controls to have had a prior strep infection in the past 3 months. So any child who's possibly being given these diagnoses, we really need to look at strep, because that could be the trigger. There's a much higher risk among those with multiple strep infections within the past 12 months. Cases with prior strep infections have been found to have more relapses. So the relapsing remitting course that I told you about, those are going to be more frequent, more likely when they've had a lot of strep in their prior history. And again, patients often have a history of recent strep infection that doesn't give them a sore throat. So they don't have symptoms like a fever, a rash, a bellyache, sore throat. They don't have those, classic strep symptoms, but they still have an infection. So that's PANDAS. What causes PANS? So the second most common cause of PANS, strep is first. The next is mycoplasma pneumoniae. I just did a blog post about this at the end of September. So you can go to thewhymatters.net and read a little bit about mycoplasma. But typically, this is the bacteria that will cause walking pneumonia. But again, this can, our kids have dysregulated immune systems, so they don't always show us what's going on. So it's really common for us to find a mycoplasma infection in a child who has no symptoms whatsoever. So mycoplasma, second most common cause. Viruses. So viruses are a very common cause of PANS. I would say clinically, what I see in my practice is the most common viral trigger is Epstein-Barr. We also see other triggers like HHV6, HSV1 and 2. Both of those are herpes viruses. There are hundreds of herpes viruses, and we all get that, right? So it's just a matter of, if the child gets one of these viruses, can their immune system, manage it, or will it take a wrong turn into autoimmunity and brain inflammation? Sometimes we'll see influenza as the viral trigger. Sometimes it's Coxsackie virus. Sometimes it's cytomegalovirus, parvo, or COVID as well. We also have other triggers that are metabolic that we talked about. So mycotoxins or mold can absolutely be a trigger for PANS. Yeast in the intestine, parasites, anything that's tick-borne as well can be a trigger for PANS. So we talked about the relapsing remitting course. So flares are part of that. So what can trigger a flare? So generally it's an exposure to a pathogen. It doesn't necessarily have to be the pathogen that's the original trigger. So let's say this is a kid with PANDAS, and they are, of course, that's caused by strep, but they are exposed to something that triggers or stresses their immune system, like the flu, like seasonal allergies, and that can then trigger a flare for them. So anything that stresses the immune system. So maybe they have another exposure to strep or a different virus or the same virus. Allergies and sinusitis can definitely be a trigger for a flare, as can getting a vaccine. We have other metabolic stressors as well. So things like trauma or anesthesia, a high stress situation, mold exposure, pesticides, environmental chemicals. We're starting to see a lot of kids who seem to be triggered by dyes as well. So food dyes like red dye 40, things like that. So we really work with families to understand the implications of food dyes as well. This is a one that usually blows people's minds. So anything dental can trigger a flare in a child too. So a loose tooth, a new tooth coming through, getting fitted for braces, a palate expander, a vigorous cleaning, anything like that in the mouth can definitely be a trigger. And it's really common when we kind of go back and look at the timeline to see that, they get a loose tooth and suddenly their behavior devolves and they start having lots of triggers. So, a lot of times we're on a countdown. How many more teeth does this child have to lose, so that we can kind of relax a little bit and stop worrying about the flares happening so frequently. So there are things that make kids vulnerable to this, and it's important to know this so that we want to be long-sighted, right? We want to play the long game here. We want kids to be stable in the long term. We want them to recover from this and be as healthy as they possibly can. And so for long-term stability, we need to know what makes them vulnerable. And the things that I most commonly see in kids in my practice are things like nutrient deficiencies. Maybe it's B vitamins or fatty acids. Sometimes it's low vitamin D. A lot of times kids are anemic and we don't know it until we test. The other thing that can really contribute to this is low cholesterol. I have done webinars on low cholesterol, and I've also written blogs about that. So you can look at any of those resources on the whymatters.net. And often what goes right along with nutrient deficiencies is mitochondrial dysfunction. So we have to be able to take our food and digest it and then turn it into energy. And the turning it into energy is generally something that complex kids are not great at doing. Again, I've done blog posts and webinars about that as well if you want to learn more. Intestinal dysbiosis is a big part of this too. So maybe they have a bacterial overgrowth in their intestine. Maybe it's a yeast overgrowth that's causing maldigestion, malabsorption of their nutrients. And nervous system dysregulation. A lot of times our kids' nervous systems are stuck in fight or flight, and they don't effectively sort of go back and forth between rest and digest and fight or flight. So that's why we see a lot of kids who have things like constipation or chronically poor sleep, right? Because they're not moving over into that rest and digest nervous system response. When you're stuck in fight or flight, you cannot heal, you cannot learn, you cannot grow. And so that's why we want kids to be in fight or flight when they need to be, but then be in rest and digest when they need to be. So the literature says about 1 in 200 kids has PANS or PANDAS. I think it's more than that. Based on what I see in my clinic, I think it's more than that. Average age of diagnosis is between 4 and 13. And a lot of people think you have to have autism to also have PANS or PANDAS. Not true. We have many, many neurotypical kids who end up with a diagnosis of PANS PANDAS. So to figure this out, here's what we need to do. So we have to take a thorough history, especially around contagious illness exposure. We also need a thorough family history. We want to know, is there a strong history of strep in the family? Is there a strong history of autoimmunity in the family as well? Because 64% of kids with PANS PANDAS have a first-degree relative who has an autoimmune diagnosis. So it definitely makes them vulnerable to PANS PANDAS. And then, of course, a thorough physical exam. So to do that, I always, if the child will let me, really look at their throat. Again, remember, strep infections are often found without a sore throat. And so doing the good exam and doing testing is super important. And then we need to do labs. So general labs, labs that are specific to try to identify which pathogen or toxin is causing this, labs around inflammation, immune system function as well. So it's critical to identify and treat the correct pathogen in the right order. We can't just throw everything at it all at once, because otherwise, if we put the cart before the horse, the kid is going to struggle to get well. So traditionally, if it is a bacterial pathogen, the treatment is antibiotics. And what literature tells us is that kids who get antibiotics had their OCD symptoms go away in 8 of 12 kids with pandas. So sometimes antibiotics are the right thing to do. Sometimes doctors will use steroids. Sometimes they'll use anti-inflammatories. There are some people who think just giving it time is the right thing to do. Giving it time is not the right thing to do. Absolutely not. We do not watch and wait. We do not wait and see. We don't give it 6 months, because when we're suspicious of PANS pandas, we need to get in there and make changes as soon as possible. Sometimes you'll hear of a treatment called IVIG. This is intravenous immunoglobulin therapy. So IVIG is a blood product that is administered via an IV that helps kind of reset the immune system. It's a complicated process, but about 65% of kids show improvement when they get in OCD symptoms when they get IVIG. Sometimes having tonsils and adenoids out is a treatment. Sometimes it's the right thing. It really just depends on the kid. I'm not a fan of taking out perfectly good body organs, but sometimes, I have frequently seen kids who have gotten better after tonsillectomy. And then if it's a different pathogen, if it's not strep or it's not bacterial, then traditional docs may use things like a prescription antiviral, or, maybe a prescription antiparasitic medication, things like that. For holistic interventions, this is really sort of my area of expertise. We look at natural anti-inflammatories, natural antihistamines, because this is going to cool that encephalitis, that brain on fire situation, and it's going to kind of halt some of that immune system overreaction and sort of that detour into autoimmunity. I rely on homeopathy very heavily for kids with PANS pandas. Again, it depends on the child. I write an intervention plan specific to that child. I don't do, exactly the same thing for everyone. I really like homeopathy because that helps us speak to the long game, right? Because if, let's say we're going to use antibiotics also, antibiotics are great for the short term. They're going to knock out that bacteria pretty quickly, but it's not going to speak to the overall need to stabilize that immune system response like homeopathy will. So I like it too because different formats are available, different forms, which makes it easier to dose for kids. So we have liquids, sometimes we can use pellets, there are suppositories, there are capsules. So it's just a really good, gentle, but effective approach. Sometimes we'll use herbs, again, depending on what the pathogen is. And then, of course, we have to address what made them vulnerable in the first place. So if we found nutrient deficiencies or intestinal dysbiosis, if we found nervous system dysregulation, we have to do something about those things if we expect that child to heal and be well long term. So with the right approach, we often see that kids improve quickly. However, to be reasonable, generally it takes a fair amount of time to calm the inflammation, to cool off the immune system, autoimmunity, and see changes. But what we know is the faster we get to this, the better the outcome is for that child. And parents have to remember that flares are quite probable. It's just part of this issue because it has a relapsing remitting course. That's part of the diagnostic expectation. And so flares can be really tough because, you think your child is getting more stable, they're doing better. You can exhale a little bit and breathe, and then suddenly you get hit with a flare. And that can be sort of traumatizing for the whole family. And so you need to find a provider who will help you work through strategies to apply when flares that are probable come. So, unfortunately, there is some controversy over PANS PANDAS. Many doctors will say they don't believe it's a real thing. There are, large hospitals in our state that will just say, we don't believe in it, we don't test for it, we don't intervene for it. So, because of this, families often have a really hard time finding a practitioner who is willing to help, who is equipped to help, who's educated, who's experienced. Um, Sometimes we can find practitioners, but they follow a super strict diagnostic criteria model. So, for example, if the onset of their anxiety or their compulsive behavior wasn't abrupt enough or acute enough, then they'll say it can't be PANS or PANDAS when everything else is really pointing to the fact that it is. So again, multiple diagnoses in a child. So things like maybe a behavior disorder, ODD, OCD, autism, ADHD, anxiety. Multiple diagnoses should be a red flag to doctors, and they should absolutely consider a PANS PANDAS workup. So if you want more information, a couple of really trusted sources for you would be the pandasnetwork.org and then the Pandas Physician Network, so pandasppn.org. Both of these have good, reliable information, and you can find providers in your area as well, particularly on the Pandas Physician Network. You can search by your area and find doctors who are experienced. So, if you are worried about your child, I will tell you, kids don't develop a mental illness overnight. So if you are looking at your child and thinking, what is going on? What's with the sudden change? Why are they doing X, Y, and Z all of a sudden? You need to look at this sooner than later. You need to find a doctor who has extensive clinical experience in the area. We are always taking new patients. We are very experienced with PANS and PANDAS. We love that we have Dr. Hannah Strong with us, the general pediatrician, because she is also developing more expertise and experience with PANS PANDAS and is willing to help. So definitely don't sit on this. If your parent gut is telling you something is off, definitely let's dig in and see if we can figure out how we can help. It may not be PANS or PANDAS, but we really need to do the right labs to know that. So here's our contact information. We're here in Jefferson City, Missouri. These are all of the practitioners we have on staff. That is my email address, clinic phone number, and our website as well. And I mentioned some resources. So I do this webinar every month. I do 2 blog posts a month as well. And those are all housed at thewhymatters.net. And you can navigate across the top to, see the blogs or the webinar replays, things like that. So if you feel like you need some support, we're definitely here for you. If you're interested in scheduling as a new patient, you would need to get with Brittany. Her email address is brittany@covenantwellness.net, and she will be happy to help you. So that was a lot in 38 minutes, wasn't it? So very complicated topic. I literally could talk about it all day because, it's a passion of mine. I just don't like it when I feel like families and kids aren't treated in a competent way. And, I was around when the autism epidemic happened, and now I'm around when this PANS PANDAS epidemic is happening. And it's troubling to watch. And it's difficult to hear families when they tell me, we feel like something's going on with our kid. We're desperate for help, but we can't find anyone to help us. So yeah, that's our story. So do you have any questions before I let you go? I'll give you just another minute or so to drop questions or comments in the Q&A box, and I'll be happy to answer those. If you feel more comfortable, you can always email me questions too. So drsonia@covenantwellness.net. All right. Well, I hope you learned something today. I hope it was helpful for you. I know that I said a lot and I said it fast. So if you want to access that replay, because you registered, you have access to that. You can watch it as many times as you want to at your own convenience. So I hope everyone has a great weekend, and I look forward to seeing you next month. We're going to be talking about, I believe, food allergies and sensitivities, and it should be the first Friday in November. I think it's November 4th. Don't hold me to that, but watch social media and you'll get all the details about that. So have a great weekend, everybody, and we'll talk to you soon. Thanks.